I hope that what I've shared with you today sparks your interest to want to work with these patients, because they need your help. And not only do they need your help, but I need your help, because my practice has grown and gotten so busy. I get phone calls, emails from all over the country and now the world because of the internet. And there's a shortage of doctors who want to work with these patients. If you do choose to work with these patients, you can help them. They'll make you a better doctor. You'll have to think smarter. You'll have to work harder initially. But you'll get more enjoyment out of your practice if you like to do this kind of medicine. You can't just kind of show up and fake it with these people. These people have read more books than you'll ever read about it. They're very well educated. But once you start working with fibromyalgia patients, you can treat any illness that comes into your practice. We don't have time this morning to go into low thyroid. We don't have time to go into digestive disorder, yeast overgrowth, chemical sensitivities, food allergies. We don't have time to go into all those things. Reflux. What a bunch of crock that is, reflux. Well, they're putting people on stronger and stronger medications, when really what they need to be taking, as you all know, digestive enzymes, right? I don't have time to go into that and thrill you with all that information. But just know, if you do choose to work with these people, once you start getting some results and get your sea legs under you, you can feel confident that just about anybody that walks in your practice you'll be able to help them with. Whether you're using integrative medicine, using prescription, combination prescription and naturals, or you're a non-allopathic doctor and you're using nothing but nutraceuticals. So I encourage you to learn more about how to help these people. Now, this time I'd like to take some questions.
You commented on the role of magnesium with fibromyalgics. Can you comment, because one, it can have muscle relaxation, two, it can stimulate the bowel. What form is the best form to use? Is it a
the question was, can you comment on magnesium and what's the best form? I like anything that's chelated. So if it ends in an 8, I like it. Taurate, citrate, that's what I like. Now, one of the things you'll find also, if you'll use magnesium potassium aspartate, which is part of the Krebs cycle, you'll see that you'll increase the cellular energy, especially for those in CFS. So in my formula, one of the things I have in there, part of the magnesium is in there, is in that form, combination of magnesium, potassium aspartate. Most vendors, suppliers will have a magnesium, potassium aspartate that you can. Now, what I use is a formula. You take open a pack, and maybe some of you use that in your practice as well. You just open the pack, and it's got 8 tablets in it. So it's got all the optimal daily allowance multivitamin, essential fatty acid, free-form amino acid blend, a malic acid tablet. It's probably something else. I don't know. But there's a lot in there. Yeah.
You had mentioned in the original protocol that you start off with 50 milligrams of 5-HTP. If they can't sleep, you increase it by 50 milligrams. When do you decide to make that increase? How far do you go before you start to transition to melatonin?
The question was, you start patients on 50 milligrams, and they increase if they're not sleeping, and how do you know when to increase that, or how far do you go? Well, you'd have to come to my doctor 2 days sooner to know that. I'm teasing. God, y'all are so, what is the deal with it? Okay, it's gloomy weather. This is how I do that. The sleep is the key. Sleep is the key. But ideally, you want to get them around 300 milligrams of 5-HTP. You don't, unless you've been doing this for a while, I wouldn't recommend getting them to go above 300 milligrams at bedtime. You can if you're experienced with it, but you normally don't need to do that. If they're not falling asleep on 300 milligrams or staying asleep through the night, that's when I start using melatonin. If, though, they fall asleep on 100 milligrams, they're doing great for a week, but then they start having problems with sleep again, I increase the 5-HTP. But usually what I'm trying to do is get them to 300 milligrams. And how I do that is I'll have them take the dose they need to go to sleep, and then I'll have them add the additional 5-HTP during the day with food, because, especially with fibromyalgia, we want to get their serotonin levels high as we can, because you saw all the things it affects. So if they are sleeping really well and they come back in 2 weeks They tell me, you know, sleeping great, I'm taking 100 milligrams. My first question is always, how are you sleeping? That's numero uno, every visit. But number two will be, well, how's your pain? If they come back and they tell me, well, my pain's still really bad, that's telling me they need to get their serotonin up higher. So I ramp that up, okay? And that would lead right into a nice segue. What do you do if they're on 300 milligrams of 5-HTP and still having a lot of pain? Well, that would be a whole nother seminar. But what that is, then you start using things like S-adenosine, SAMe, or D-phenylalanine, or some of the things that you have out there that help to regulate pain.